We go inside your health to talk about a lot of those ads we see on TV for different types of medicine. Well, this May, the FDA is implementing some new rules for TV and radio ads, those ads that promote prescription medications. They will not be allowed to include medical jargon. They won't be able to speed through the side effects portion so quickly anymore. You actually have to be able to understand it. One aspect of drug advertising may continue, though. Manufacturers may still be able to shorten the name or even make a new name up for medical conditions to try to make it easier for patients to remember. So we have our KSTP medical expert, Dr. Arkel Georgiou, here with us. We're going to talk through some of this. You've got some advice about what we can do when we see these ads. You said this morning, you're watching TV this morning, you saw a couple of them already happen, and you thought, what are they advertising? What are these names? Give us an example of some of the acronyms they're coming up with, the different names they're using.
I mean, I really just saw 3 this morning within like 15 minutes. So let me give you some examples.
Okay.
One is TED. As a physician, never heard of that. Stands for thyroid eye disease, based on this commercial. Low T, low testosterone. RLS, restless leg syndrome. If a patient had ever said that acronym to me, I would have never known what it was. And then the original, which probably started this whole trend, is ED, erectile dysfunction, which made it easier for men to talk about impotence when Viagra was coming on the market.
All right. So why are they doing this? Is that really what's behind it? It makes it easier for patients to talk about this stuff?
Oh, all of it is about driving awareness and promoting sales of new drugs. And sort of there's a pretty basic strategy behind it, Leah. So the first thing they want to do is raise awareness of a condition so that more people might think that they have it. They want to make it easier to call that condition, by a name that's not so complicated medically. So they make it easy. They use an acronym, and they also want to make it less stigmatized. So, of course, ED, less stigmatized than impotence. And what they really want to do is have you think, oh, I might have that. I'm going to go talk to my doctor about it, which drives sales.
Which drives sales for drug companies. Right. So why does the FDA allow for this to happen? Why does it allow advertisers to create these new terms, not doctors?
Well, first of all, it's the pharmaceutical companies that are making the drugs and funding it, and that's, who wants to make a profit from selling these drugs. But, the FDA pretty tightly regulates what pharmaceutical companies can say about the drugs themselves. We're going to see new regulations in May. But they don't regulate what pharmaceutical companies can say about conditions. So if you noticed in all of my examples, I didn't talk about any of the drugs. I talked about the conditions that are being called something different because the FDA doesn't regulate that. So there's a lot more leeway in there.
Okay, so we're seeing some changes here. What kind of recommendation do you have? You are always promoting, be a savvy consumer, be a patient who advocates for yourself. What can we do when we're watching these ads and we don't quite know what to make of them?
Here's what I would say. Many of these ads will either on TV or the radio or direct you to an online site where they ask you to take a quiz. Okay, take the quiz, but take it with a grain of salt. If it says you have condition XYZ, then maybe talk to your doctor about it, but recognize that we all have dry eyes sometimes. It doesn't mean that you have dry eye syndrome. We all have restless legs sometimes. So even if you screen maybe positive on these quizzes, don't convince yourself that you need a medication to treat it. Talk to your doctor, but it's not necessarily a slam dunk that you have to be treated.
It's a good reminder. All right. Dr. Georgiou, thank you so much.
Thank you.
And we will be right back.